That brings us to item number 2, which is adopt a resolution supporting the rights of individuals and businesses to be free to choose how to protect themselves from COVID-19. I'm going to read the resolution into the record, and then we'll have discussion. Supporting the rights of individuals and businesses to be free to choose how to protect themselves from COVID-19, March 22nd, 2021. Whereas we have accepted the shared responsibility of protecting the most vulnerable and at-risk in Mesa County, and we have done that. And whereas the original intent of the stay-at-home order was to flatten the curve to ensure adequate capacity in our hospitals, overall hospital bed usage in Mesa County continues to decrease, so hospital capacity is no longer an issue. Excuse me. Whereas our local businesses are important to the economic health of our community and are especially critical to those that employ their families and their customers, our local businesses have been at a disadvantage when compared to national businesses. And whereas Mesa County residents are ready to resume their routines and build back the economy. Therefore, be it resolved, excuse me, that the Mesa County's Free to Choose initiative will go into effect at the point in which all Mesa County residents 16 years of age and over have adequate access to the COVID-19 vaccine. We anticipate that date to be after April 16th and no later than May 1st. Under this resolution, 1, businesses may choose whether or not they will limit capacity with their facility and whether or not they will require face covering, social distancing, or other safety measures. 2, individuals may choose whether they want to continue to wear face coverings, stay at home, or frequent businesses that may or may not require face coverings, social distancing, or other safety measures. 3, Mesa County Public Health will continue to encourage all residents to wear a face covering and to social distance whenever possible. However, it is ultimately up to individuals to choose what level or risk they are comfortable taking and how to best protect themselves and their loved ones. 4, for the time being, Mesa County Public Health will continue to recognize 5-star facilities, but they must continue the practices they've adopted to maintain the designation. And 5, organizers of events are encouraged to implement social distancing and other safety measures. Events with more than 2,500 attendees must go through a plan review process with Mesa County Public Health. Nothing in this resolution intends to force people to not wear a face covering or to leave their home if they are not comfortable. Nothing in this resolution intends to force businesses to not require face coverings or social distancing. Rather, this resolution empowers people to make these choices for themselves. Duly moved, seconded, and passed this 22nd day of March 2021, the Mesa County Board of Commissioners, Janet Rowland, Scott McInnes, and Cody Davis, and it was duly moved, seconded, and passed on the 17th of March 2021 by the Mesa County Board of Public Health, Errol Snyder, Will Hayes, Gretchen Gore, Connie Mack, and Kevin Fitzgerald. Do either of you have any comments about this?
Sure, I'll start out. I just want to say, first of all, Dr. Kerr, thank you for all you've done through this pandemic. I don't want this resolution to lose what you've done. I know you've been hyper-focused on protecting people from the COVID vaccine, but I think this resolution kind of puts the Mesa County Public Health and government in general kind of back in its proper role and allowing people to make that decision for themselves. Now, I don't want it to be lost that the Mesa County Health Department still has recommendations for people as to how to social distance, wear masks, and things like that. But it also puts the responsibility for a person, a business, an organization, a church to make those decisions for themselves. And the responsibility is back on them, which in essence is the true definition of freedom. So again, and this is the beauty of this entire resolution is a person's ability to choose. If a business wants to continue to socially distance and take those recommendations from Dr. Kaur and the state and require a mask, they can do that. It's their freedom to do so. And it's also the freedom of a business to not social distance and wear masks, as well as churches and organizations alike. So again, this resolution is not intended for people to be judgmental towards others who make decisions for themselves, but rather gives them the freedom to make the decision for themselves. So if a person still feels fearful of this disease, of this virus, they can continue to stay home. They can continue to social distance, wear masks, and even have their groceries delivered to their front door. So again, this just opens it up and allows people to make those decisions for themselves.
Thank you. Do you have any comments?
I do, Madam Chair. Thank you. Well, when you take a look at the history that's come up before this resolution, this county has really been a leader in the state of Colorado as far as trying to figure out how to address it, making sure that our Department of Health, for example, was well-funded, well-staffed, and well-led. And nobody disagrees, of course, with the leadership we've got, probably some of the best, well, in my opinion, the best leadership in the country. Our county, Mesa County, was the first county, not only the first county, but we are the actual ones that came up with the program in cooperation with the Chamber of Commerce of the 5-star program. And I remember when we put the 5-star program into place, we had some, not a lot, but some remote criticism. Hey, it's not fair for Mesa County to have this program if we don't have it in our county. And we even received criticism from counties that join us that usually don't criticize Mesa County, but saying, hey, we're not going to get into that 5-star program. And then pretty soon, after we led the way through the forest, they figured out to get on our path instead of trying to plow their own route. And the reason was they couldn't get through it. And we were successful at doing that. So I think we've kind of set a precedent as being a leader in regards to the next step. How do we deploy? What do we deploy out there to get out of this virus? Now, obviously, through a lot of very skilled pharmaceuticals work, et cetera, the vaccines been put in place. But here in our county, take a look at who was first for hospital capacity, the coordination, our emergency plan that was actually in place for many, many years, not specific to this virus, but if we had a crisis, we actually had a plan countywide. We had the mechanism in place in this plan of the umbrella organization to address it on a countywide basis. So when you take a look at those steps, the fact that you had combined vaccination, our county is very well situated, very well seated, so to speak, to take the lead role on the next step. And the next step's logical. Look, our hospitalizations, I think over the weekend we had 3 on one day and I think a big jump to 5 the next day. And so things are going good. We're prepared for it. And we're prepared to lead on this, and that's exactly what this resolution does. So I wholeheartedly support the resolution, and I think the community and the people of the county support the resolution as a whole.
I agree. We have taken into consideration comments from others about the resolution, and in fact, the first whereas came as a recommendation from our district attorney, Dan Rubenstein. I thought it summed it up well, and we also included it in our letter. And we met with the Board of Health on last Wednesday. Was it Wednesday? Yes. And went through line by line and took their advice and made some changes to this resolution. So I do believe it's been fully vetted. And we, having heard from the leaders of St. Mary's and Community Hospital, as we did last week, that they are in support of this, I don't know how we can argue that it's not time to let people decide for themselves what level of protection they want to take when it comes to COVID. So I too support the resolution, and I'll open it up to the public for comments. Yeah, thank you, Dr. Kerr.
Thank you, Commissioners. Thank you, Madam Chair. Jeff Coor, Director of Public Health for Mesa County. So as you mentioned, the Board of Health did vote to support this at their last meeting on the 17th. I want to point out, as Commissioners Davis and McInnes have alluded to, the 5-star program, that was really about choice as well from the very beginning. I mean, we weren't about cracking down on businesses to close them. I mean, we had our ebb and flow with that, but once we got it all corrected, it was the choice. People could choose to go to a 5-star business or they could choose not to. So we've been doing this in Mesa County. We know how it goes. I want to thank you for basing this on vaccine availability. Certainly that is an issue. This isn't a static start date of April 16th. We've got that range in there, which is great to have. And I want people to know that we will continue to do case investigations and contact tracing and monitoring hospitalizations. And when we get increased hospitalizations, when we get outbreaks of cases, we will mitigate. I have a team that does nothing but work with places that have outbreaks to reduce risk of further infection in those facilities, and we'll continue to do that. We will continue to do testing. There are a lot of testing sites that we have available. In addition to the fairgrounds, CMU's got 3 different sites. As I mentioned, we'll continue to vaccinate with everything that we get. Commissioner Davis mentioned, providing continuous guidance to people that do want to continue to implement these. Some businesses and facilities have to play by different rules. They're governed by a corporation. They may have federal guidelines, state guidelines. We've got facilities that are governed by DORA. So to alleviate the confusion, we will work with those agencies to take in what their guidelines are and make it clear to them what they need to continue to do. And then we'll also pay close attention to the high-risk settings, our congregate facilities. That was really the source of our big spike in cases was when our nursing homes got hit. We'll work with our nursing homes, our jail, our homeless population, to make sure that we keep risk down. Continue to work with the schools, child care facilities. So nothing will change as far as our risk reducing efforts with Mesa County Public Health, but it does go back to allowing individuals to make choices. When we were making the case for the 5-star at the beginning, we said these places of business are not the sources of our infection. They do not deserve to be penalized. So it's a continued partnership. As you said, Commissioner McGinnis, I've followed the lead of the commissioners the entire time, and so we will continue to do that with this. Thank you.
Thank you, Dr. Kerr. And I do want to make a note, too, that make sure it's really clear to folks that we're not mandating the vaccine. That is totally a choice. Nobody in Mesa County is going to ever be required to have a vaccine, at least not by at least this member of this board. And April 16th is the goal date, but
Right.
As you said, if there is still a wait list for the vaccine, then we'll hold off a few days up to, but not further than May 1st. And I think you made a good point about those businesses that have corporate headquarters elsewhere. I would guess the majority of our businesses won't be able to change some of these requirements because of their corporate rules, but
Yep.
certainly local businesses are able to do that, will
That's
be
right.
able to do
You
that.
bet.
Thank you.
Yeah, and to your point, we have made this about vaccine availability, not about number of vaccinated. That's a choice as well, and
Right.
we can only do what we can do. We can make it available.
Yeah, thank you.
Thank you.
Anyone in the audience? Okay, come on up. Yes, you can come up, Bruce. Go ahead up to the microphone.
Would you like me to tell you, my name is Bruce Miller, and I live at 3032 North 15th Street, apartment number 1204. Now, what I am here to do is simply state that I believe that if we are going to have a policy about such things as allowing people civil liberties, so forth, so on, to err on the side of caution rather than to err on the side of allowing people to do things that might endanger them. Boy, that was a tough one, huh?
Thank you for your comments, Mr. Low-Miller.
Questions?
No, we don't have any questions. Thank
I'm
you.
gonna run for office. You better watch.
Anyone else in the audience have any comments? Come on up, Ms. White.
Okay.
Please state your name into the record, and again, remember, our comments are limited to 5 minutes.
Won't take that long.
Okay.
So Ricky Howie, Coffee and Civic Action. Oh, a lot of feedback here. So Mr. Davis had an interesting editorial in yesterday's paper about the consequences of eating mac and cheese. And his mom made him eat a whole heaping of mac and cheese at a restaurant. And I'm suggesting to you about consequences that if Master Cody had gotten sick and had barfed all over the floor at that restaurant, his mom wouldn't have been the one to get down on her hands and knees in her Sunday dress and clean it up. It would have been somebody else.
It would have been me cleaning that mac and cheese.
I doubt it. I doubt it. So here are some questions about consequences. As of the 1st of this month, 8th of March, Builders First Choice has had 14 cases that are unresolved. And if Builders Choice continued to not socially distance or wear masks, and people hadn't read information about this, I guess the consequences would be on the person who walks through the door. But how about Manti Heights congregate setting? There were 5 cases reported on the 26th of, or at least up to February 26th. And Wishes and Dreams Daycare for the same, another 5 cases. So you have an older person in a congregate setting, and someone who is an employee or the employer decides that they've had enough of paying for PE and they want to open up, and we continue to get new cases. Look at the jail. Those cases may be resolved with new people filtering through. Those folks do not have choices, and they face consequences brought on by other people's decisions. So I'm just suggesting where there's still a 40% chance of high-risk folks not being vaccinated yet, of staffed hospital beds being at the 100% mark, at least according to the health data dashboard, and about 60% of the cases in Mesa County not being identified as having a source, okay? So I find it a little difficult to line that information up with opening up. I'm suggesting, and I know you're set for the 1st of May, but I think figures after the Easter break and after Easter church services are going to give us all a better source of infection rates than what you have right now. And what would be the effect of an increase in cases in Mesa County, including variants, on this resolution? Thank you.
Thank you, Ms. Howie. Anyone else in the audience? I think she had her hand up first. Come on up and state your name into the record, please.
Good morning, Commissioners. Nini Anderson. I own the franchise for Express Employment Professionals. We've been open 14 years. I am here to talk to you and thank you and Dr. Kerr for what you have tried to do for businesses in our county, but to also share what, as a business owner, I have in consequences of what is this prolonged virus reaction. Last year, the federal government required that businesses pay a COVID leave up to 80 hours. That was only required until December 31st of 2020. Our Colorado legislators passed Colorado Healthy Families Act, which stated as long as we were in a state of emergency under the health, the companies of, irregardless of size, were required to pay that 80 hours of COVID leave. The federal government had exempted companies of 500 or more employees. Colorado did not allow that exemption. So as a franchisee of Express Employment Professionals, the people that I put to work in this community, which today is 215 people, are required to be paid COVID leave while they wait for testing results or while they recover. It sounds all great and good that that would be the requirement, but let me tell you what it has done to my business by having that required on 500 or more employees, which the people I put to work are. And they're not directly my employees. My business is not built for the overhead of paying their COVID leave. My business is built for the overhead of my office staff and paying their COVID leave. This mandate, and even though I increased my rates to my customers in January by 2%, my volume from March through March this year compared to last year, my volume is up 30%. That sounds like a great business model, doesn't it? My margins are down by 1.5%. My savings continues to deplete with the COVID leave mandate pay. I have reached out to our Colorado representatives, our Colorado senators, myself along with other Express franchisees. This business model does not seem to resonate with our county or state administrators. So I'm asking for your support in whatever you can do at the state level to make sure that we get out of this continued mandate and this continued health scare to get us out from under this COVID leave pay that is depleting my business model and ruining my savings. And thank you and Dr. Kerr again for everything that you have done to date. And I just want to ask you to continue the battle. Thank you guys very much.
Thank you, Ms. Anderson. Anyone else in the audience? Yes, come on up, Mr. McAllister.
Thank you. I'm Mark McAllister. I want to talk to you about the impact that no one's doing the math on. The child abuse, domestic violence, suicide. That's an impact that people don't look at. It's really important. We need leadership that stands forward and recognizes that. If you look at the real numbers, our own Chamber of Commerce told us, a week and a half ago, small businesses suffered by 35.5% in their personal revenue. Violent crime in the city of Grand Junction is up 36%. That's because of a lack of leadership. People got to stand up and put us back to work and put family and economic value in its right place. I'm asking you guys, please, enough is enough. You talk about consequences. Those are real consequences. Look at it. Do something about it. Thank you.
Thank you, Mr. McAllister. Anyone else in the audience have any comments? Yes, come on up and state your name into the record.
Thank you, Commissioners. My name is Nate Porter. I own two small construction businesses here in town, as well as one development team and or development company. And I just want to tell you thanks for this free to choose that you're focusing on today. Because as a small business owner, as an American, I think that that's why we love this country so much. And I have elderly people in our family that live literally next door to me. And so we try and be very careful as well, but we also recognize the freedom that people have to choose whether or not they go out into public. I frequent a lot of restaurants here in town. I was reading the paper yesterday, and I also read the article that the lady mentioned about the macaroni and cheese, and I've been in a similar situation. The restaurants that I do frequent are all on the 5-star program, and some of them are very adamant that you wear a mask when you walk in, and out of respect for them, I do. There are some restaurants that are not adamant that you wear a mask, and I don't. So it really depends on the owners of the restaurant and the staff. So I just want to say thank you for what you're doing, and I know it's not an easy position to be in a position of leadership where you're making decisions that are not popular with half the population. So you're in a lose-lose situation, or in my case, you're in a win situation by making that choice on the freedom to choose. So thank you for doing that, and Godspeed.
Thank you, Mr. Porter. Anyone else in the audience have any comments on this item? Okay, seeing none, I'll bring it back for discussion. And a couple of things I wanted to add when Mr. McAllister talked about the other things to measure is that actually Dr. Premenko had told me there's been a significant increase in alcoholism during these COVID times and an increase in hospitalization as a result for detox. So those are certainly things we need to pay attention to, and to also remind folks this is not about the infection rates. That's never been, at least my goal. We will always have viruses. Government cannot protect us from a virus. It's about hospitalizations and deaths, and we've seen a significant decrease in both of those with the availability of the vaccine. And again, people can still wear a mask, and either masks work or they don't. And I've always been puzzled by the belief that if I don't wear a mask, I put someone else at risk because their mask doesn't protect them. I've never understood this one-way magical fabric that keeps germs from coming out of my mouth, but doesn't keep germs from coming in my mouth. And so people can still wear a mask, as Commissioner Davis said, they can have their groceries delivered, stay at home, whatever they need to do, but there are people and small businesses and kids that need to get to school and businesses that need to open their doors. So I am very much in support of this. Did either of you have any other comments?
Yeah, I do. I have two anecdotes, and one is just in response to Mrs. Howie's comments on Builders First Source. They chose of their own volition and at the cost of their customers and their employees to shut down for 2 weeks. No one told them to. They did it themselves to try to stop the spread. So that's what we're talking about, people taking that responsibility for themselves, and they did that for themselves. Two, my cousin is currently battling cancer. He's immunocompromised and he can't have the vaccine. And he's imploring me to pass this. He says, because of where I'm at, should not be putting freedoms at risk for other people. So, and I know it's anecdotal, but it means a lot. So, and again, we're trying to find that balance because I think I'll speak for myself, I think I'd be a fool to say that there have not been unintended consequences to this. And we are trying to strike that balance. That's why we have engaged the hospitals. We have engaged Dr. Kaur and his health board. So we are trying to strike that ultimate balance here with both the freedom of choice and the unintended consequences of these shutdowns. So I am in support of this resolution.
Thank you, Madam Chair. Well, I think, first of all, the resolution strikes a perfect balance. I think it's exactly what we need to do. It's exactly what we did with the 5-star program. It's exactly what we did with our own county employees. You follow the pattern all the way through. And I'd like to make a couple comments in regards to some of the witnesses that spoke. First of all, Nate, I think you understate your business. If we talk about 5-star, your homes are 5-star, by the way. Well done. And I can't tell the way you're sitting, if that's your family with you, if you're sitting an aisle ahead. Is that your family or that? Man, that makes me smile. I look out, everybody in here, we need something to uplift us. And all I can see are those fine kids looking right at us. We better do our job right. Anyway, thank you and your family for coming in. Ricky, once again, I have a problem with your testimony, as usual. Last week, just out of the blue, you decided to make some very derogatory remarks towards an individual whom my guess is you had zero background on. And I'm sorry to say this to you, but I just think it was inappropriate. Last week, after I mentioned that, you acknowledged that those statements were inappropriate. And now, today, you're taking on individually named businesses. And the remarks you made about those businesses were, they could really have a negative impact on those businesses. And my guess is that neither you nor us have the facts of what occurred at those particular businesses. And I'm just saying, doggone it, I don't mind in general if you want to complain or whatever, your input's valuable. I've taken a lot of your comments you've made have been constructive. But we have to be careful. These businesses are struggling out there. And for an individual to come in front of the public forum and pick Mesa Manor or something like that, now maybe I'm all wrong. Maybe you know all the details. Excuse me, I'm not. You're out of order. So maybe you and I stand corrected if in fact you know all the facts. You've been out there. You've interviewed the people. You understand exactly what happened in Mesa Manor was an error. My point being is all of us, not just you, myself included, we have to be careful not to jump the gun, pick an individual or a particular business here in the community and go after them. Now, if the facts are there, all for it. So anyway, I think that was inappropriate. Nina, excuse me. Your remarks kind of bring up my thought, how dare the state legislatures and the governor, after hearing what you say. Today, I think there's an editorial or guest opinion in the Denver Gazette Express. And they talk about nobody's even setting off an alarm about the fact that the state unemployment is missing about $2 billion, not $1 billion on unemployment. Most of it is assumed to have been scammed out of the unemployment system. On top of it, the state comptroller's office was audited by the auditing team, and they can't account for, I think it was $1 billion, and verify my facts. That editorial is very easily accessible. They're saying the comptroller who balances the books is off by $1 billion. You don't hear about that anywhere. And instead, they're focusing, in my opinion, coming down on the businesses of which you spoke to put more and more burdens upon them. And they're saying, and a guest editorial next to it, which is an editorial, talks about, now this bill hasn't passed yet, but the new litigation that they now want to pass at the behest of the Colorado Trial Lawyers Association. And so when you put this resolution in contrast to that, you know, at the local level, we're doing it the way it ought to be done. I just regret the fact that we get preempted on a lot of these things by the state of Colorado. For example, what really is kind of gets me the wrong way is a state position, which they've taken on a couple of things, and that is, geez, you know, other counties, it's not fair if Mesa County really figures something out. They ought to be held back, not promoting and saying, wow, great, although the governor on a couple of occasions has complimented Mesa County. But instead of encouraging us to continue to plow through the snow, wait a minute, we don't want your driveway plowed before anybody else's gets plowed, even though you're out there with your plow working hard on it. And so I thought your comments were very appropriate. I'm excited about this resolution, and I don't usually go through the list of our witnesses, but I think today's testimony supports that. I think it's very beneficial, and who knows? I mean, we can't guarantee this thing's not going to come back. We all felt pretty good after the first wave went through, and we had every reason to feel good about it. And then we got slammed with the second wave. This is the third wave. We've got the vaccine. We're on the offense, and we feel very comfortable working for the people of this county, coming forth with this resolution and saying, all right, we're ready to get out of the foxhole again and advance a little further down the field. And that's exactly what the resolution does, and I wholeheartedly support it. Thank you, Madam Chair.
Thank you. And I believe there's nobody on the phone that wishes to testify. I heard from Lana a little bit ago there was not. So seeing none, then I will entertain a motion to approve the resolution supporting the rights of individuals and businesses to be free to choose how to protect themselves from COVID-19 as read into the record.
So moved.
Second.
I have a motion and a second. All in favor signify by saying aye.
Aye.
Aye. Motion carries 3-0. Our last item for individual consideration